Hi folks, Mark again. I wanted to take a couple of minutes to talk about another issue that comes up very frequently with the people that I work with and the people that I train, and that is IT band pain and stiffness and soreness, and knee pain and soreness and stiffness. Usually their suspect is they run a lot, or they walk too much, or they play basketball or something when they normally don't, and that's the reason why they're sore. Well, that has something to do with it. But let's back up and talk about what the movements are in that particular sequence of events when you run, walk, or play basketball or whatever. When you run and walk, the knees are constantly shifting side to side because the knee joint is not a strict up and down muscle. It actually has a small rotation to it. So the knees are constantly moving side to side when you walk or run or play basketball or whatever. The body uses a process known as hip abduction to mitigate that issue. Hip abduction is when you are standing on your feet, you move your legs outward this way from the center line of your body. That is hip abduction. And that is the process that your body uses to mitigate the knees, the movement of the knees when you're running or walking or exercising. So with that in mind, the primary mover in hip abduction is not the IT band of the knee. It is in fact the gluteus medius, or the glute med. And it's a fairly decent sized muscle on top of the buttocks. Then its primary mover, or primary job rather, is to use the hip abduction. If the glute med is weak, or it doesn't fire like it should due to lack of exercise or an injury or some other kind, it doesn't do what it's supposed to do. It recruits another muscle called the TFL. The TFL, or as it's technically called, the tensor fascia latae, is a smaller muscle right below the gluteus medius. And the tensor, the TFL, is too small to handle hip abduction on its own, but it is attached to a large, thick piece of meat on the side of the leg known as the IT band. The IT band runs up and down from the knee all the way up to the top, and it's basically a large piece of fascia. So the TFL recruits the IT band to help with the hip abduction process. The IT band's main function is not hip abduction. It's not made as a dynamic stabilizer for the hips. Its main function is to mitigate the movement of the knees. So it's basically a knee stabilizer. So if it's recruited to do something it's not designed to do, oftentimes it gets overused and irritated and very sore. And that's where the IT band pain comes from. The knee pain will then come from the fact that the IT band has not been able to do its job because it's recruited for other things, so the knee then becomes sore as well. So that's really the whole process, starting from the gluteus medius all the way down to the knee, that is in the hip abduction process, and that's the reason why typically, without, like I said, injuries and accident surgery, things like that, the reason why you have IT band pain and stiffness. So when I test for this, when somebody comes to me with that type of soreness, the first thing I test for is a weak gluteus medius, and the large amount of the time that is exactly what it is. And I have exercises for them to strengthen that, and we're going to get into all these stretches and exercises to help out with this, to test for it first of all, and then to increase the strength of that particular muscle. Because when you walk or run for a very brief amount of time, you are literally standing on one leg, even if it's just for a short amount of time. So when you walk, because you're not hopping or something like that, you're literally standing on one leg at a time when you walk. So it puts an incredible amount of pressure back here, which all radiates down the leg. And that's the reason why we have such pain and stiffness. So look for the videos coming up on the rehab and stretching, and I promise they're going to help you out a lot, and I think you're going to enjoy those. So keep that in mind coming up, and remember, you can be better.